how, Maureen, is your staff, this invisible network of frontline people, how are they coping during this crisis, often with lack of equipment and just the burnout themselves? What's your pulse of where your staff are at?
It's early days, but like I think all of us, they're frightened. They're very frightened about what COVID could mean to them in their personal health. But even more often, I'm hearing expressions of worry about transmitting it back home to their families and household members. And that is a real pressure for them to feel torn between their mission to be working in the community, to providing in-person care as a personal support worker to a senior, or as a homeless drop-in worker, reaching out and comforting somebody who's been exposed to COVID in their shelter the night before. Those frontline workers, in my view, are as exposed to risk as healthcare workers. And we are working with the healthcare sector to try to understand each other's needs, in particular around personal protective equipment, and the way that we can try to keep people out of the hospital. We know the hospitals are just going to be incredibly overloaded soon. So if we can keep people out of the hospital, or once they're in there, get them out of the hospital as fast as possible, there will be more room in the hospitals to deal with the really severely ill, the people who are really severely affected by COVID-19. So our staff are scared, but I think one of the definitions of bravery and courage is even when you're scared, you continue to do it. And I just appreciate our staff so much because I know they are scared.